Hello, I'm Dr. Hilary Jones, a GP and medical broadcaster, and some of you may have seen me crop up on breakfast television over the years talking about a variety of different medical conditions. Right now, I want to tell you that I've teamed up with Pall Mall Medical, and I want to talk to you about flu, influenza, very topical right now because during this pandemic, what we're worried about is a second wave of coronavirus, which, if it coincided with seasonal flu, which it often does during winter, then we would be in real trouble in the NHS. So it's so important right now to think about how we can prevent influenza and protect ourselves going forward. So let me start by asking some of those frequently asked questions. What is flu? Well, flu or influenza is a respiratory infection caused by a variety of different viruses. And these flu viruses change on a frequent basis. And the jab that is offered to people is an injection which protects against the three of the most virulent influenza viruses which are circulating in the world this coming winter. Why do we even need to worry about the flu? Well, for most people, the flu is an infection which comes on within 2 days of being exposed to the virus and can last anywhere between 10 and 14 days. It's pretty nasty though. Most people are bedbound. They can't do much for a few days and they need to treat it themselves with paracetamol or ibuprofen and plenty of fluids, and then they get over it. But for some people, particularly the elderly, pregnant women, people with pre-existing conditions, it can be very nasty indeed, and we do see an excess death rate every winter from the flu. So it's not something to be taken lightly. Who qualifies for a flu jab? Well, we recommend that everybody over the age of 65 and over has a flu jab. I've mentioned pregnant women, people with immune deficiencies caused by anything from chemotherapy right through to HIV, people with respiratory conditions, people with heart conditions, people with liver or kidney disease. There are many groups of people with pre-existing conditions that should seriously think about having a flu jab. Are there different types of flu vaccination? That's a question that's often asked, and yes, there are. Children, for example, from the age of 2 can be vaccinated, but they use a nasal spray and a different type of preparation, if you like, to the injection that most other people have. And the elderly over 65 might have a different type of injection. It just means that it is specifically targeted to help their immune system to get up to speed to fight any potential flu virus that might come their way. So there are different types, but by and large they do the same thing. They boost our immunity, our immune cells, into creating an antibody response should we come across the real thing. And that's important. Would the flu jab stop me getting coronavirus? Wish that it would. Unfortunately, the flu jab protects against 3 of the most virulent circulating flu viruses in the world at the current time, but it wouldn't protect against coronavirus. So we still need to be vigilant and be careful not to be exposed to that. Can children have the flu vaccine? Well, it is possible they can have the flu injection, but most children will be offered the nasal spray. It's a much simpler form of delivery, and it has the same effect, protecting children and particularly those who are most at risk with pre-existing disease. Can the flu vaccine give you flu? The answer is no. The vaccine is either an attenuated virus or a killed virus, so it gives you the antibody response and it protects you by and large against the flu, but it can't give you the flu because it doesn't contain the virus itself. All it might do is in terms of side effects is give you a slightly sore area around the injection site. It might give you a very slight fever, but this is very rare, and most people hardly notice the effect of the vaccine at all. How quickly does the vaccine take to work? Your immunity will be boosted within 10 to 14 days. It takes about that long for your antibodies to be produced, and that will give you the protection against the real virus should it come along. How effective is the flu vaccine? Well, research shows that it will not only protect 40 to 60% of people who have the vaccination, but it will also reduce hospitalizations and, of course, loss of life in those people who are most vulnerable to it. Can you exercise after the flu vaccine? The answer is yes, you can. You can carry on doing exactly what you normally do without any problems. In fact, the research that has been published shows that it's actually beneficial to exercise because it encourages the circulation and it takes the contents of the vaccine further around the body to stimulate the immune response even more. So the answer is yes, and it probably is a good idea to exercise after the vaccine. Should you think about a flu vaccine if you're a healthy person with no pre-existing conditions? The answer is, what harm can it do? It will protect you in the same way that it protects everybody else against the flu virus, and it will protect you from up to a week, 10 days in bed with a very nasty fever, headache, muscle and joint aches. I would say yes, it's well worth having and considering having it done privately on that basis. When should you have the flu jab? Well, the flu season is the winter season, and about the beginning of October is the best time to start thinking about your flu jab, because the peak of the cases that we see are seen between December and January. How much will the vaccine cost? Well, at Pall Mall Medical, it'll cost you just under £20, $19.99, I believe, and you can simply make the appointment yourself. No need to be referred, but phone up, book the appointment at your convenience, and there you go.